Hello everyone, and welcome. Today I'm excited to present on conjunctivitis, commonly known as pink eye. I'm Dr. Mayuri Rani, and I'll be guiding you through this important topic. In this presentation, we'll cover what pink eye is, its causes, symptoms, and ways to manage it effectively. Let's get started and explore this common eye condition together. Let's take a closer look at the symptoms of conjunctivitis. When someone has this condition, they often experience redness in the eye, which is usually quite noticeable. Accompanying this redness, there's often swelling and a feeling of irritation or grit in the eye, almost like something is scratching the surface. Many people also notice a watery or mucus-like discharge, which can cause the eyelids to stick together, especially after sleeping. Sometimes, there's also increased tearing and sensitivity to light. Recognizing these symptoms is key, because they help us differentiate conjunctivitis from other eye issues. Understanding these signs is an important step in managing the condition effectively, which ties back to our overall goal of promoting eye health and proper treatment. Viral conjunctivitis is a common cause of eye inflammation, and it's primarily caused by viruses, most often adenoviruses. It's highly contagious, which means it spreads easily from person to person, especially in close contact settings like schools or workplaces. When someone has viral conjunctivitis, you'll notice symptoms such as redness, watery discharge, and sometimes a gritty or sandy feeling in the eye. It often affects both eyes, although one might be more affected initially. This condition is usually self-limiting, meaning it tends to resolve on its own within a week or two, but it's important to maintain good hygiene to prevent spreading it to others. Unlike bacterial conjunctivitis, antibiotics won't help here, so the focus is on supportive care like artificial tears and avoiding touching or rubbing the eyes. Understanding viral conjunctivitis is key because it ties into our overall theme of infectious eye diseases. Recognizing how contagious these infections are helps us implement proper precautions and educate patients effectively. Let's now turn our attention to bacterial conjunctivitis. This is a common eye infection caused by bacteria, and it often presents with some distinctive features. One of the key points to remember is that bacterial conjunctivitis typically causes a noticeable red eye, along with a purulent or thick mucus discharge. This discharge can cause the eyelids to stick together, especially after sleep. Another important aspect is the onset. It usually develops quickly and may be associated with pain, although the degree of discomfort can vary. It's also worth noting that bacterial conjunctivitis is highly contagious, so good hygiene and contact precautions are essential to prevent spread. In the context of our overall discussion, understanding bacterial conjunctivitis helps us differentiate it from other causes of conjunctivitis, such as viral or allergic types. Proper diagnosis is crucial because bacterial infections often require antibiotic treatment for effective resolution. So, recognizing the signs, redness, pus, and contagious nature, helps us manage and advise patients appropriately, ensuring timely treatment and preventing transmission. Today, I want to discuss allergic conjunctivitis, which is a common condition that many of us might have experienced at some point. It's essentially an allergic reaction that affects the conjunctiva, the thin membrane covering the white part of the eye and lining the eyelids. When exposed to allergens like pollen, dust, or pet dander, our immune system overreacts, leading to inflammation. This results in symptoms such as redness, itching, tearing, and swelling of the eyelids. What's important to understand is that allergic conjunctivitis is usually seasonal, especially with pollen, but it can also be perennial, meaning it occurs year-round due to indoor allergens. Connecting this to our overall theme of eye health, recognizing allergic conjunctivitis early is crucial because it can often be mistaken for other types of conjunctivitis, like infectious ones. Proper identification helps us manage symptoms effectively and avoid unnecessary treatments. So, understanding the triggers and symptoms of allergic conjunctivitis plays a vital role in maintaining overall eye comfort and health. So, one common symptom you might notice with conjunctivitis is watery eyes, along with a mucus discharge. This happens because the eyes are reacting to irritation or infection, leading to increased tear production and those characteristic mucus secretions. Now, conjunctivitis can be caused by various irritants, things like smoke, dust, or chemical exposure, that can trigger this response. When the eyes come into contact with these irritants, they become inflamed, resulting in redness, watering, and discharge. It's important to recognize these signs because they help us understand that the eye is trying to protect itself or respond to an irritant. Connecting this to our overall theme, understanding the causes and symptoms of conjunctivitis can guide us in managing or preventing discomfort effectively. Remember, identifying whether the cause is an irritant or an infection is key to choosing the right treatment. Let's talk about transmission, which is a crucial part of how systems operate and communicate. When we refer to transmission here, we're talking about how signals, data, or energy move from one point to another. This process is fundamental because without effective transmission, information can't be shared efficiently or accurately. Key points to consider include the medium through which transmission occurs, whether it's wired or wireless, as each has its own advantages and limitations. For example, wired transmission often offers higher reliability and speed, while wireless provides greater flexibility and ease of deployment. Another important aspect is the quality of transmission, which depends on factors like signal strength, interference, and bandwidth. These elements can affect the clarity and speed of data transfer. Connecting this to the overall theme of the presentation, understanding transmission helps us appreciate how technology enables seamless communication and data exchange, which are vital for modern systems to function smoothly. So, mastering these concepts ensures we can design and manage systems that are both efficient and resilient. Let's talk about allergic conjunctivitis. When do we suspect that conjunctivitis is caused by allergies? Well, if it happens seasonally, especially during times when pollen counts are high, that's a strong clue. You might also notice the patient's eyes are incredibly itchy, which is a hallmark of allergy-related eye problems. Additionally, if the conjunctivitis occurs alongside other allergic reactions like hay fever, asthma, or eczema, that further supports the allergic origin. Now, moving on to diagnosis, it's important to look for these signs and symptoms in the context of the patient's overall allergic history. Recognizing these patterns helps us differentiate allergic conjunctivitis from other types, ensuring we provide the right treatment. Remember, understanding these key points helps us connect the dots in managing the patient effectively. When it comes to eye symptoms, some signs are more serious and warrant immediate attention. If you experience pain in one or both eyes, that's a clear signal that something is wrong. Sensitivity to light or blurred vision that doesn't improve even after wiping the discharge away can also be concerning. These symptoms might indicate an underlying issue that needs prompt evaluation. Additionally, intense redness in the eyes is another red flag. If you notice that your eye or eyes are significantly red and the symptoms are worsening or not getting better over time, it's important to seek medical help. For example, pink eye caused by bacteria that doesn't respond after 24 hours of antibiotics might be a sign that the infection is more severe or not bacterial at all. People with a weakened immune system, such as those with HIV, cancer treatments, or other medical conditions, are at higher risk of developing complications from conjunctivitis and should be especially vigilant. For newborns showing any symptoms of conjunctivitis, it's crucial they see a doctor right away to prevent any potential complications. And finally, if you have conjunctivitis along with other concerning conditions, such as severe pain, vision changes, or symptoms that worsen despite treatment, don't delay in seeking medical advice. Prompt evaluation and treatment are key to preventing more serious issues. Prevention is really the cornerstone of managing any issue effectively. By focusing on prevention, we're not just reacting to problems after they occur, but actively working to reduce their likelihood in the first place. This can involve a variety of strategies, such as education, early detection, and implementing best practices. The key is to identify risks early and take steps to mitigate them before they develop into bigger challenges. When we prioritize prevention, we enhance overall safety, efficiency, and well-being. This ties back to the overall theme of our presentation, showing that proactive measures are often more effective and less costly than reactive solutions. So remember, prevention isn't just about avoiding trouble. It's about creating a healthier, safer environment for everyone involved.